OEI therapy is a powerful approach for healing trauma because it combines neuroscience with bilateral stimulation. OEI therapy was evolved from EMDR, eye movement desensitization and reprocessing. OEI therapy helps clients process trauma safely and gently without you needing to talk about painful memories. In this video, we're going to explore how OEI therapy can help you integrate overwhelming experiences, help you reduce emotional intensity. Because when trauma is integrated, it feels like the past is in the past, and you can rediscover safety and move forward with hope. OEI therapy stands for Observed and Experiential Integration, and it was developed in the mid-1990s by Audrey Cook, who's a marriage and family therapist, and my mentor, Dr. Rick Bradshaw, who's a psychologist. Audrey Cook has a background in trauma work with Indigenous Canadians. She focuses on multi-generational trauma and family systems. And Dr. Rick Bradshaw is a clinical psychologist with a background in psychoneurophysiology and trauma therapy. They both have worked together since the 1990s and created OEI therapy as a response to the needs of these trauma survivors. OEI therapy was evolved from EMDR, which is eye movement desensitization and reprocessing, which is a well-established trauma therapy. OEI uses visual pathways and bilateral stimulation to help process traumatic memories. OEI has evolved beyond EMDR to integrate elements from neuroscience, body-based therapies, and mindfulness. I'm a hypnotherapist, and I chose to be certified in OEI therapy because OEI considers the neuroscience of trauma and how trauma bypasses verbal processing, which is why talk therapy often can't get you across the line in resolving trauma. Many of my clients find me after years of talk therapy or trying things that require you to talk about your trauma. And talking about trauma is what we know, but it's better if we process trauma non-verbally, because talk therapy often keeps us stuck in the trauma. It's the unresolved emotional element of trauma that actually keeps you going back to talk therapy or other therapies like EMDR that require you to talk about your trauma. But in doing so, I believe that this creates an iatrogenic effect where talking about your trauma might actually, although unintentionally, cause more harm. Because as someone who's experienced trauma, intrusive thoughts already hijack your brain in the present moment. It's something that you can't control. And you have these feelings in your body as if the trauma was happening in the present moment. And you're so in the trauma that you might even start to identify with it. I experienced this when I met a woman at my neighborhood Hapa restaurant. As she was introducing herself, she told me all about her trauma, like a total stranger. It's because of the way that trauma gets processed, or rather, doesn't get processed. It stays in the present tense, and it doesn't get put in the past like other memories. So these memories need to be resolved and processed non-verbally. OEI uses specific techniques like covering or uncovering one eye, tracking finger movements. As an OEI therapist, we observe these unconscious moments, facial expressions, eye movements, body posture, tension. That's the observed part. And the client also attends to body sensations, which is the experiential part. OEI focuses on integrating both sides of the brain using eye movements and visual pathways of memory, and that's the integration part. This allows clients to process trauma gently without needing to talk about their painful and personal traumatic experiences. This is less re-traumatizing than some other methods, because if you've experienced trauma, it's already hijacking the present moment. It's taking over your life. And you're trying to get away from the experience, not revivify it by talking about it. OEI therapy is especially helpful for those who find traditional talk therapy overwhelming, or when they're not 100% satisfied with what they're trying to do to solve their trauma. Clients find me when they've tried everything but nothing else seems to be working. I use OEI therapy and I accelerate it with hypnotherapy, because OEI helps my clients process and integrate traumatic memories by observing and experiencing things shift in their thoughts, their feelings, their emotions, and the sensations in their body. And when trauma is integrated, you'll feel like that experience is in the past, where it should be with all your other memories. It'll stop hijacking your present moment, and it'll stop taking up all the space in your future, so that you can start to have hope again. You can start to feel safe and create a whole new future for yourself in your life. Let me know what you think in the comments. If you've tried EMDR, how that was for you. If you've tried OEI therapy, subscribe and like this video for more content on OEI therapy and how it can help you resolve and integrate your trauma. And let's connect on the next one.